Whatever the chronic skin wounds, treatment involves several steps. Before applying CACIPLIQ20, the wound must be thoroughly cleansed. The purpose is to remove debris such as exuding material, dead tissue, bacterial biofilm, clotted blood or fibrin, cluttering up the bottom of the wound and preventing healing. The purpose is both cleaning and disinfection. Normally, cleaning is done either by using products containing proteolytic enzymes or by prior softening of the skin for at least 24 hours with a hydrating solution based on hydrogel or hydrocolloid, with or without scraping the bottom of the wound with a scalpel or curette. It is also possible, if the patient can tolerate the pain, as in diabetic neuropathies, to proceed directly to scraping the bottom of the wound. Another effective, though not widespread, technique is the use of maggots within the wound. Abundant rinsing with saline is necessary to remove debris, reduce bacteria, and promote effective healing. Do not use products such as iodine, providone iodine or metadine, or topical antibiotics of the aminoglycoside family such as neomycin or gentamicin. In case of poor debridement, CACIPLIQ20 will not enter the bed of the wound. This will prevent or reduce the action of CACIPLIQ20. Efficient debridement is a prerequisite for CACIPLIQ20 to penetrate the microcracks or clefts of the wound and restore the internal scaffolding of the extracellular matrix. Application Kit CACIPLIQ20. The box contains 2 kits CACIPLIQ20 for 1 week of treatment, that is, 2 vials of sterile CACIPLIQ20, 2 blister packs each containing 1 sterile compress, and 2 sterile pairs of tongs. With a kit CACIPLIQ20 you have the necessary material to treat a chronic wound. All manipulations must be done in a sterile environment. Firstly, open a blister pack containing the compress. Open a bottle, removing the capsule. Empty the entire solution CACIPLIQ20 onto the compress. Two. Open the packet containing the tongs. With a pair of tongs, take hold of the compress. Apply the compress to the surface of the wound and ensure good contact between the wound and the gauze so as to soak the bed of the lesion. 3. Leave the compress in contact with the wound for 5 to 10 minutes, then remove it. 4. Cover the wound with a non-adherent bandage so as to avoid tearing the skin newly formed during the healing promoted by CACIPLIQ20. Do not use dressings containing cationic salts such as silver, copper, etc. Each application of CACIPLIQ20 requires a new operation of debridement if the wound again shows fibrin, exudates, biofilm or necrotic tissue. Otherwise, a simple saline rinse should suffice before reapplication of a new CACIPLIQ20 compress on the wound. This treatment should be renewed only twice a week or every 3 to 4 days and be continued until full and complete closure of the wound. More frequent application undermines the effectiveness of the product. Do not use CACIPLIQ20 in cases of hypersensitivity to heparin or its derivatives. In the unlikely case of severe itching and/or swelling, stop the treatment and consult your doctor.